When you're in the hospital for the initial rehab, you're followed by multiple physicians, and then you leave the hospital and you're on your own. I recommend within 4 weeks, a patient should see their primary care physician.
Certainly I was concerned because when you get out of the hospital, every new event that you go to is a challenge.
It wasn't easy at first. I'd meet doctors, and they would look at me and say, I'm sorry, I'm not up to date with your kind of needs.
My first urologist sent me to a second urologist because he felt like he was younger and would be more helpful. And so I went in there and he really didn't know what to expect.
I think primary care doctors tend to get a little intimidated when they see somebody come in with a catastrophic injury, whether it's a brain injury or a spinal cord injury.
I've definitely found that most doctors are willing to learn and be acceptable to my experience, because I feel like I am the best person to know my care in and out and know what's wrong and things like that.
I went to a dentist, but I didn't tell them in advance about my needs. And when I got there, the little room that you go into to get into the chair, it was like, a closet, and I couldn't fit.
The dentist is the hardest place to go because the chair is curved and it's much harder to get into the curved surface. I have a scrawny dentist, so he's not much help.
I had a mammogram recently. The mammogram machines are really made for you to be standing up. One lady's behind me shoving me up, and the other one's trying to get the boob on there, and I'm holding on for dear life in the chair, and it was the weirdest experience of my life.
I have found that patients can sometimes struggle when following up with practitioners who maybe don't have the right tools or equipment to be able to handle somebody who is in a wheelchair.
When you make your appointment, you tell the person that you're talking to that you are in a wheelchair, and would it be better to bring a power chair, or can I just use my regular wheelchair? And that is probably the most helpful thing that I've learned as far as going to the doctor.
I would call ahead of time and see if you can get your paperwork mailed to you, because sometimes you'll get in the office and have a book to fill out. So that just saves time. And lots of times they will mail it to you. Go ahead and get that mailed and ask them while you're on the phone, is your office accessible? I'm in a wheelchair. This is what I'm gonna need. If you've got a bigger room, I'm gonna need the bigger room.
The most intimidating thing about going to a doctor's office or going into any place that would be tight in very limited space is that when you get there, the staff tends to think that, oh, okay, you're in this chair, that's fine, just move over here or push over there. They tend to be a push you in the corner attitude, and that really intimidates me because I am not a piece of furniture.
Well, they just don't know. They aren't sure and they've never experienced it. And so being vocal about it kind of eliminates the confusion a little bit.
When they ask a question, I try not to snap back. I try to be understanding, because before I ended up like this, I didn't understand what it was like to be in a wheelchair, and I don't think anybody has any idea what it's like to be this way all day, every day. So I have to be nice back to them.
As far as adaptations in a physician office setting, I think it's always important to find out if your wheelchair would be able to get into the office, if they would have someone there that could help you transfer onto the examining table. Oftentimes, it'd be helpful to have family there so that they can help you transfer.
I've visited my primary care physician, my dentist, my ophthalmologist, my dermatologist. Each one of them have challenges in their office, and I found that for me, I'm able to transfer over using a slide board when I go to my dentist or to my ophthalmologist, and those folks really do need you to get into their chair, for them to do what they need to do.
Weight is always a struggle for our patients when they're following up with their practitioners. Obviously, having a larger scale that would allow for a person in a wheelchair would be ideal, but that can be very challenging for our patients.
I felt like there wasn't great understanding that I wasn't going to be able to have my weight every time I went to the doctor.
Most of the time, they don't weigh me because they don't have the means to do so.
They told me I would have to go to the stockyard, so nobody seems to have a scale that I can get on. And I'm not going to be in a fight with a cow, so I don't go to weigh. I just have to hope.
This is how we weigh at my house. And I have to beg my husband to do this because he's like, please don't make me weigh you. It hurts my back. I really just don't want to do this. He throws me over his shoulder and weighs the two of us and then puts me down and weighs himself and subtract it. Well, that routine is getting old. So now I just have to go by, do these pants fit this week or do they not? Okay, they don't fit. I've gained weight. Oh, the next week, hey, they fit. These pants fit. So I would love if more doctors would, have the beds that weigh you or have accessible scales to get on.
The less having to struggle to get clothes on and off or shift clothes would be beneficial.
I personally don't go out of my way to wear like specific clothing because I work a full-time job and I'm likely to duck out on my lunch break to go see an OBGYN. So whatever I'm wearing at work, which is typically a pair of jeans, but because I do take a caregiver to assist me with transfers and dressing, we have kind of a way to get me undressed once we get me up on the table. Normally she kind of sets me towards the edge of the table where my butt is just right there on the edge, and she kind of bends my knees to her chest, which tilts my hip just enough that she can just grab the side of the jeans and slide them right off.
My natural blood pressure is a lot lower than the average blood pressure. So every time they take my blood pressure, they're like, oh my God, are you dying? Are you still pumping blood in there?
I want to encourage everyone to be patient with their physicians and realize that they may not know about spasticity, autonomic dysreflexia, neurogenic bowel, neurogenic bladder, bone loss, any of those things.
In my experience with spasticity, and doctors most know semi what it is. It's more explaining my experience with it and what my spasms are like.
Spasticity is when your muscles contract or jump around or inconvenience you in some capacity. I certainly experience some spasticity during the examination while at the OBGYN office. Typically, when using the speculum, my legs will want to snap shut. I have to have somebody on both sides to kind of help keep my knees apart.
When preparing to go to a practitioner's office, it would probably be best to make sure they've done their bowel program either that morning or the night before, performed a catheterization before, unless they know they need to routinely leave a urine sample.
Autonomic dysreflexia is an irritating stimulus beneath the level of injury, and typically the main three causes are full bladder, anything pertaining to the bowels, or anything pertaining to the skin. So an OBGYN exam, for example, could cause autonomic dysreflexia.
When my patients leave Shepherd, I actually tell them, you will know more about spinal cord injury than most people you'll ever come in contact with because of the training we've done with you here.
The worst thing for us is if you come without us knowing in advance and we aren't prepared and we can't meet your needs. That leaves us with a bad feeling, it leaves you with a bad feeling. So the best thing is to be upfront, open. I have a spinal cord injury. This is what I need. Is that something you can accommodate? There are some offices that will say no. But if you give us the chance to be prepared for it, we can certainly make the visit a much smoother one.